Hi, it's Dr. Grunch. If you're watching this video, these are the instructions, the post-op instructions after a peroneal nerve release at the knee. This is a decompression of the nerve that comes around the side of your knee that I performed on you. And I will send you a separate video just kind of explaining how the actual surgery went and what I found in your case. This video is going to specifically kind of go over the do's and don'ts of the surgery, wound care, and recovery expectations. So typically what I do in this case is I make an incision that's about this long, right on the lateral side or on the side part of your knee. We go in there and decompress that nerve, and I then close the incisions with Vicryl sutures and skin glue. So on the outside of your skin is actually glue, and there'll be a dressing on top most likely. You can remove that dressing and take a shower in 24 hours after the surgery, and the dressing can come off. You do not need to leave the dressing, any dressing on top after the dressing has been removed. If there's any concern about redness of the incision or drainage, please call the office and let me know. But typically there's not a lot of drainage or redness that you should see from the incision. There may be some swelling. So what I want you to do is you need to wear a pair of thigh-high compression socks, which are socks that go above your knee and kind of squeeze your legs, and that'll prevent swelling of the leg, because any swelling of the leg can really cause some delayed healing and the nerve to just kind of not heal as fast. And if you do have a foot drop associated with your injury, that may take some time, longer time. So I do want you to do things that'll help reduce swelling, which is wearing that thigh-high compression sock. I want you to wear that all the time if you can for a couple of weeks. I want you to elevate your leg anytime you're not walking. So anytime you're sitting up, you need to elevate that leg on the couch watching TV or in the bed. Just keep it elevated. And then you can ice the incision 30 minutes 3 times a day. In terms of activity modifications, the first few days I wouldn't keep your leg in a dependent position, meaning I wouldn't try to keep your leg below your, like you're going to stand and walk for a period of time. I would try to just keep it elevated as much as possible, but you can walk. There's no restrictions on your lifting or bending or any of that kind of stuff. And then in terms of expectations of pain, this usually isn't a painful procedure, but I will typically send you some pain medicines in for you to take as needed. If you are having extreme pain or any nerve pain, like pain that shoots down your leg, you'll need to let me know. That's not usually expected after this type of surgery. If you do have any weakness that went with this diagnosis, like if you had a foot drop, that may take some time to improve. If you, like it could take up to a few months to see some recovery from that. If you had a lot of pain or numbness going into this surgery, that may also take some time to improve, but not typically quite as long. And some of those symptoms are even much better when you wake up from surgery. And again, I'll go through exactly what I think in your case, depending on what we see during the surgery. If you have any questions or concerns, let me know. You'll have a follow-up appointment to see us, one of my PAs, typically in 4 weeks. I hope that all this stuff makes sense. If you have any questions about any of this, please call the office.